aging needs to be prevented. Because aging is continuous, renewal needs to be continuous too. There is a list of gratitude that I formed for myself in longevity and anti-aging. So even though we discovered GLP-1 agonists a bunch of years ago and they were taking off in the healthcare community, there are several kinds of GLP-1 agonists present, but I think they were such an important treatment. These are basically sugar neutralizers that humans have now experienced, and they are game changers in how quickly your body is going to get cooked with sugar that you're placing in it in your system. So anyway, number one was the GLP-1 agonists. So number two is the finally correcting one of the most significant medical error that was committed in the previous century was to misguide women about HRT over the past over a decade, like around 12 years. We have like missed out at least a full decade since 2002 to the present. Like only in last year, the end of last year, we corrected this grievous error in medicine, which is misguiding women and scaring them and unnervingly scaring them from HRT. And this error is being fixed, is going to get fixed this year. However, I'm very happy because, sometimes even the worst medical mistakes, identifying them is so important. So that identification, the process had started in 2024, 2023, 2024. People who became like they were doctors who had become complete activists in trying to bring this change about, and finally this change happened. And now there's going to be so many women who will be treated correctly. So number three, I think, would be the use of artificial superintelligence in the realm of medicine, where it is going to take away the task of taking notes and documentation and some of the clerical tasks that we assigned to doctors away from them, which will free the doctors to totally focus their attention on the person that they're trying to help. And that's what the doctors are trained for. And that's where their attention needs to be, rather than doctors fighting with a laptop or a computer where they're just trying to take notes and figuring out which ICD-10 code, because most doctors end up getting employed by your health insurance. So the health insurance just wants codes and notes and, tasks that should be done by either somebody who's like a robot. And if we have like different people who are taking our notes, they also cost money. And I think AI makes it very efficient because it takes all the notes and organizes it, and you can then load it up to the system. And number four would then be the reclassification of medical marijuana, and that can impact the industry, is the fact that the president passed this executive order where it reclassified medical marijuana from a class 1 controlled drug to class 3, which is the same as Tylenol with codeine. So at least this opens the doors for research and more transparency as what this medication can do. And it is extremely important for people who are suffering from opioid addiction or who are suffering from PTSD of any sort, or people who have chronic pain from whether it's neuropathies or whether it is chronic pain from cancer, basically chemotherapy and stuff. So this can be super helpful because remember, human body, when we see it has endocannabinoid receptors, it doesn't have Tylenol receptors. Meanwhile, this drug cannot be any more dangerous than Tylenol with codeine. So again, codeine is again an opioid. So instead of giving somebody Tylenol with codeine for pain, it's better to give them medical cannabis under guided supervision. Number five, the fifth on my list, is longevity, anti-aging and longevity finally holding its ground and taking off. That happened in 2025. And I've been in the realm of longevity for the past over 12 years, pretty much. And I think that 2025 was the first year where I felt, wow, people are really awakening to this concept that aging needs to be prevented, because aging is continuous. Renewal needs to be continuous too. And just like we have disease management systems, there are also health and anti-aging management systems. And basically you choose, you want to fall apart and then do disease management through your insurance, or you want to be proactive about your life and health and beauty and wellness and longevity and prevent your system from disintegrating through time. So the concept of health span for lasting through the entirety of your lifespan became a thing. And this was the first year, last year was the first year that I saw that awakening, and I saw people understanding it finally and waking up to the fact that they have to look after themselves proactively and not just wait until the system is disintegrating.